Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of three. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, Strong Moms. You're in the right place. Welcome back, Strong Moms. We are on part 5 of our pregnancy pain series. Today, we're talking about round ligament pain. I've loved doing these episodes so much because this is my favorite thing to do in my office. You know, I only work basically with pregnant and postpartum patients now. I do, of course, have a few of my OGs that I see in my office still, but generally, I'm working with new moms or newly postpartum moms. And so I just love explaining these things and teaching moms how to get out of pain on their own, because it is not acceptable to just say, oh, you're pregnant, you're in pain, that's normal, deal with it. No. We're not going to deal with that. No. We're not going to accept that as an answer. So today we're talking about round ligament pain. So first of all, let's talk a little bit about what the round ligament is. So you have 2 round ligaments, okay? You have them always, right? They connect your uterus to your body, but during pregnancy, they stretch a lot. So there's one on each side. They connect from the front of the uterus, they go down through your inguinal canal, and then they attach basically right down near your vagina, okay? And so sometimes that's why you can feel some pulling down through there, because that is actually where they attach. Now, I happen to think the round ligament is one of the coolest parts of the female body because it is the only ligament in the body that grows muscle into it while you're pregnant so that it can stretch. Usually muscles and tendons go together, right? There's no other ligament in the body where there's muscle in the ligament. So this muscle grows in so that it can stretch. And then after the baby comes out, it goes away. It retracts. It's crazy. It's so unbelievable. And so that's why if you feel this intense pulling, I'll sometimes have patients say oh gosh, it just feels like something is just a muscle is pulling. Yeah, that's why, because there are actual muscle fibers within that ligament. Maybe you don't think this is as cool as I do because I'm an anatomy geek, but it is really cool. So what it does is it actually helps to stabilize and support your uterus. And as your uterus is growing and shifting, it becomes even more important. And so how do you know if you're having round ligament pain? Well, you probably know, but maybe you don't know that that's what it is. So it can feel like a sharp pulling, stabbing feeling in your abdomen. It's usually felt sort of in the lower abdomen, near the groin, kind of sometimes even near the front of the hips. And certain things that can trigger it could be rolling over in bed. That's one that I hear a lot. A really sudden movement, like a cough or a sneeze. Standing up really quick if you've been sitting for a while. And sometimes even single leg movement. So if you're doing single leg deadlifts, lunges, step ups, sometimes those can cause a little bit of pulling as well. You can also get round ligament pain, and I usually see this more on one side when your pelvis is not in alignment. So again, I've mentioned in all of these series, if you can get in to see a Webster certified chiropractor, that is the number one thing I recommend you do, because they can help make sure that your pelvis is aligned. You can imagine if one hip is really rotated forward, that's going to change the way that hip, that ligament, that everything on that side of the body is pulling. And so that can just cause increased pain, tension, and that sharp pain sometimes. If you can't get in to see someone, I do have my pelvic pain fix plan. That's why I designed it, honestly, is for all of these conditions. Sciatica, round ligament pain, low back pain, pubic bone pain, all of those things I address in that plan. I teach you how to align your hips all on your own at home. And then each one I go through and say okay, now here's what you should stretch. Here's what you should strengthen. Here's what to do for each one. So check that out if you're needing additional help. So what can make round ligament pain worse? Let's say you've been having it a little bit, but you've noticed it's been getting worse and worse. First of all, this is something you want to mention to your doctor or your midwife because you want to make sure there's not something more serious going on. Sometimes they might be able to give you some guidance on what to do. Hopefully they give you some guidance and they don't just tell you to deal with it, because that is the pet peeve of my life. I just cannot stand hearing moms being told that. But one of the reasons it could get worse is overstretching your hip or your groin. Sometimes I have women come into my office and they say I've been stretching my inner thighs. I've been doing this mobility, that mobility. It's getting worse. And that's the reason. We have to remember that we already have, no matter how far along you are in your pregnancy, there's a lot of relaxin, there's a lot of hormones in your system changing the way that your pelvis, that all your joints really work. Okay. And so you don't want to be cranking on those joints. You don't want to be overstretching that. The other thing that could flare it up, make it a little bit worse, would be like moving too fast. So if you are trying to run, if you're trying to sprint, if you're doing like a HIIT workout or a CrossFit workout where you're moving very quickly, that can sometimes irritate it as well. Again, just because there is actual muscle in that ligament. So anytime like a muscle could pull, you could get the same sensation from the round ligament. The other thing I like to make sure that women know, especially when I'm doing like consults online, not necessarily if they're in my office because we can like just address this and take care of it, right? The other thing I want to make sure you know is this could be an early signal that something is going on with your pelvis, right? Because it's not normal, especially for one side of the round ligament, to be pulling and tender and tight, right? That generally means there's some misalignment in your pelvis. And if you don't address it and get some help with it, not necessarily, I'm not trying to fear monger you here, but it could lead to bigger issues, right? You could end up with hip pain, you could end up with low back pain or pelvic girdle pain or pubic bone pain, basically because of that anatomical component of what you're feeling, of the pelvis just being rotated. So I think the earlier you can address this and get some help with it or start working on it on your own, the better, right? Because then things don't snowball off of each other. Okay, so what can you do? Obviously, I already mentioned getting in to see someone, trying my pelvic pain fix plan. Both of those are going to be like step number one, okay? The next thing you can do, and I have patients do this at home on their own, is a little bit of self-massage. Let's say that your right round ligament is bothering you or you're getting that like pulling sensation just kind of low in the abdomen. I have people do a little bit of self-work there. So you can put a little bit of lotion and you can kind of like massage around that area. Remember, the baby is very protected, okay? So you can do a little bit of work, especially right on the inside of that hip bone. There shouldn't necessarily be a baby like right there, you know? So you can work on that area. You don't want to be digging in, right? Like you're not trying to, if you've ever had psoas work done, like deep psoas work, that's not what we're doing here. We're doing some light massage around that area, just trying to get that to release. Again, the fascia, the muscles, everything through there is attached, right? Everything's connected. So if you can get that to release a little bit, that can often be really helpful. The next thing I would have you do is focus on kind of slowing your transitions. So making sure that you're not making kind of those sudden, unguarded movements. That can be helpful. Sometimes a belly band kind of supporting your pelvis can be helpful throughout the day. Again, like you don't want to be doing this all the time, but if you're on your feet for a long time, if you're out for a long walk, if you're working out, sometimes a little bit of support can also be helpful. And then, of course, I have to mention breathing, bracing, doing some work to actually like engage the muscles that are supposed to be engaging, right? So doing some 360 breathing where you're breathing all the way around, doing some transverse abdominal engagement. That sounds like very fancy, but if you've seen anyone online doing like the belly pumps, basically where they kind of like their belly is sticking way out and they pull it in, what they're doing there is they're using their transverse abdominis to pull the belly in. They're not sucking it in. They're using their muscles to pull everything back up and in. And so that's another thing that you can focus on that can help you feel a little more supported and take some of the pressure off. The other thing I love to have moms do is do inversions. So lots of people have heard about inversions to try to get a baby to flip, but I have moms start doing inversions fairly early on, like second trimester, you can start doing them. It can help the baby get into a good position, but also as you go into that inversion, it takes a lot of pressure off of your round ligament, and just letting your belly hang, you will feel such a nice stretch through those round ligaments. I love it. So I recommend people look up spinning babies. It's really more focused on like if you have a breech baby, all the things you can do to get them to flip, which it's great. It's amazing stuff. But they have a really good protocol for inversions as well. And what that looks like is basically think of like an ottoman. You want something that's not too high up off the ground. Some couches are much too high, so a little bit lower than that. Sometimes in the gym, I'll have people do them off of like a 16-inch or 20-inch box could be fine. So you go up onto the box or the ottoman or whatever, up on your knees so that you're tall kneeling. So kind of like sitting up tall on your knees. And then basically what you do, take a few breaths there and then slowly, especially the first time, you're going to go down kind of to your elbows and then get all the way down to the ground so that your elbows are on the floor. And then you just let yourself sort of just like relax there. And so your head is hanging, your belly is hanging, your bum is like way up in the air. And Spinning Babies recommends 3 deep breaths there. So I usually have people do about 3 deep breaths too. Just a nice, relaxing couple of breaths, and then come back up and go into that kind of tall kneeling position again, just to like kind of reset, and do that a few times. And that just feels so good and takes the pressure off of those ligaments. All right, I hope that's helpful. If round ligament pain is stopping you from moving comfortably or making you nervous about exercise, definitely check out my pelvic pain fix plan. That's exactly what it was built for, to help moms through this and to be able to do all the things they want to do during pregnancy. You can find that link down in the show notes. If this episode hits home and you're like, oh my gosh, this is me, then that is definitely the next step to take. All right, strong moms, remember, pain might be common during pregnancy, but it is not normal. And with the right support, it doesn't have to control how you move or what you do or how much you can enjoy your pregnancy. Okay, until next time. Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review. It helps more moms find the support and information they need. See you next time.